Are you ready to take control of your own health? Do you want to create a plan that will improve your health and vitality without the use of synthetic drugs or needless surgery? Hi, this is Dr. Tom Roselle. I would like to invite you to join me and the Roselle Center for Healing for an information, fun-filled day that will change the state of your health and quality of life. Ageless Health 2011 will provide you with the resources to begin your journey towards being stronger, having greater physical performance, and living longer without impairment, pain, or disease. Ageless Health is about realizing that your health is a do-it-yourself program. You can have it all. Ageless Health 2011 is your first step towards creating and enhancing your natural health plan. Register today to reserve your seat.
Ageless Health 2011 is September 17th at the Fairview Park Marriott. Learn more at rosellecare.com. Don't miss out Ageless Health 2011. Register today. Call 703-698-7117. 703-698-7117.
Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio on this absolutely beautiful July Sunday. You need to be outside playing after you listen to Dr. Tom Roselle. However, 888-630-WMAL. That's 888-630-9625. That's how you get your problems fixed. Perhaps you've had one and you've tried, you applied, you've come up with the same old, same old. Well, this is the place to put the fix to it. So give me a call. Let's talk about it. Let's see what we can do. 888-630-9625. Interesting program today because you asked for it, because you've been asking why, how, and what for. And so I'm here to put the pattern together for you. And what that means is this. The subject that we've had tons of emails on, and one that we've been talking about, and one that a company is a supporter of Dr. Tom Roselle Live, is we're going to talk about thermographic imaging today. It's a subject that has a bunch of controversy around it, but one that we use and we recommend and we send out for because it helps us provide a very specific diagnostic. And to help me do that, I have a partner in Thermography Centers with me, Tammy Leiner, and she is the expert, and you're going to give you the opportunity to ask her the questions, and that's going to be a springboard into this Wednesday evening's in-house continuing education program at the Roselle Center for Healing. We're going to be featuring a night on thermographic imaging, so what you don't hear today, you're going to hear then, and also some opportunities will avail to you. Anyway, having said that, good morning, Tammy, or afternoon.
Good afternoon. How are you?
I'm great. I'm glad you're here. We're going to talk about thermographic imaging, and you have been involved in thermography and thermographic imaging for a long time.
Yep, since 2004, I started this diagnostic in my hometown of Milwaukee, Wisconsin. I've been doing the thermal screenings since then. I've also gotten my degree. I have a certificate for a level 3 thermographer. Been in the in this business for quite some time, and feel very confident about some of the things that that people can learn about. My process is an education process. I like to educate people on the benefits of all diagnostic images, so I'm happy to help.
Well, thermography is one of those things that we've used in our practice for many years, meaning that we've referred out for it, and we've had some hands-on clinical experience with it. And digital infrared thermographic imaging is non-invasive. It's a diagnostic technique that allows a physician to more clearly visualize and quantify any kind of skin changes in surface temperature, and that's really what it does. It measures heat. It has an electrical impulse that comes to the camera, if you will, and that's recorded, and it sees these different colorations and spectrums. But what I want to get into with you is the value in application clinically and why it's so important to add to people's routine diagnostic examinations. First of all, let's just talk about what thermography really is and what it isn't. So if, I said to you, or somebody said to you, Tammy, what is thermography? How would you explain that piece?
I would explain it as it's a diagnostic visual of how functional and functional patterns are happening in the body. So it looks for heat, yes, but it also looks at, different temperatures. So cold patterns can also be a problem, not enough blood flow, or an inflammatory process, meaning too much blood flow. So what it does is it looks at the body visually from left side to right. The body is naturally thermally symmetrical. What the left side looks like, the right side should look like. So they're comparable, the sides that you're visualizing. So it's going to be looked at as... Hello?
So we're looking at a differential between color spectrums.
Correct.
We're looking at a differential between hot and cold, and the mirror images from one side of the body to the other. And if we don't have that mirroring effect, then that all by itself tells us that there's potentially something there.
Correct. So for people who are more on the preventative side, that are visualizing their health, they can visualize what's working properly and maybe what needs some work.
It's one that we've used for injury patterns. It's one that we've used to complement other types of diagnostics. Sometimes we'll send out for an MRI, we'll send out for an ultrasound, or other piece of diagnosis that kind of leaves us in that middle place. I'm not quite sure. For example, a patient comes in and says, I've got a sinus headache, and it's one-sided, and in our testing in applied kinesiology, it localizes over a specific tooth, but we send them out to the dentist, and the dentist comes back and says there's nothing there. We then send out for a thermographic image, and right there at the tooth that we suspect is a heat signal that says we've got something there. Ultimately, we send them back. We said, please take a picture in a very different fashion, and lo and behold, it comes back, and we've got a positive diagnostic for something that's either eating at the root or even a temporomandibular joint problem, a TMJ, in so many different things. But it's an incredibly useful piece of information. This Wednesday evening, we're going to have an evening on thermographic imaging. We're going to talk about it. We're going to show you pictures about it. We're going to answer your questions about it in depth. You'll have the opportunity to actually have a inside look at something that you previously maybe didn't even begin to know existed, let alone understand. If you'd like to attend, call the Roselle Center for Healing at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend. And please remember that all of these in-house classes that we have are a courtesy to you. They're absolutely no charge. But because we do have limited space, we ask for a reservation. So call us today at 703-698-7117. The clinical uses, Tammy, for digital infrared thermography, what are the indicators? Why would someone want to go out and have this done?
Well, screening processes, as we've been talking about, are very easily non-invasive, but it gives the client, the patient, more information on how that their body is functioning, and so information and education can, lead you to, your ultimate goal, which is, perfect health.
We use and encourage digital infrared thermography as part of annual ongoing examinations, just like a patient goes to their general practitioners to get an EKG or to get blood work done or to listen to their heart or to have their lymph nodes palpated. The addition of this tool is so highly important because it's so sensitive and it visualizes different types of blood flow, vascular pathology, things that are happening in the muscles, things that are happening in the nervous system, before other indicators come up and say they're positive. We know the patient has a problem with their spine, and we want to find the exact location. And many times, where the pain is not where the problem's coming from.
Right. For the structural, all the diagnostics out there are mostly, looking at visualizing structural patterns. This one is looking at, inflammatory and vascular patterns, which can be completely different than what traditional, physicians are looking for. It's just a different way to look at, these patterns in the body, such as, dental infections, just like you had stated before, sinus, dental types of things. One of the most important things is the carotid artery. Heart disease is such a large, rampant, problem in this country, inflammatory processes from the foods we eat, the stress we carry. This screening is a very simple picture being taken that can assess the heat and inflammation in the carotid region, which can ultimately one day save your life.
The other day was really funny because you can see not only the progression of disease because of what the infrared camera shows, but you also can see the improvement of disease processes. Yes. In the office, Connie and Dareth and Stephanie were playing with the camera the other day, and Connie had some lesions on her, one on her arm and one on her leg that she had gotten from insect bites. And Stephanie, one of our acupuncturists, put needles around it, and then they took pictures before they did the insertion of the needles, and they did pictures afterwards, and through the progression of it. And what they saw, obviously beforehand, this bite that she had gotten outside was really hot and inflamed and irritated. And then when they put the needles in and they took progressive pictures on basically about every minute, they saw a dramatic lessening and lessening and lessening of the heat source underneath the bite area. So we could see, one, that it was there, two, that the procedure that we were doing was actually working, and also the resolution of it later on.
Absolutely. This is also something, like you can do the same sort of thing with arthritic patterns, say in the body with arthritic pain. You can visualize the inflammatory processes reducing while needle placement or right before and after adjustment. I mean, it's incredibly different. We do screenings like that all the time.
You have a patient that is complaining of or diagnosed with something called Raynaud's, which is a lack of circulatory pattern to the fingers and the hands. Often what we see with patients is in a loss of circulatory pattern to their fingers or to their feet or any other parts of their body is it's the sympathetic system, the fight-flight system, is not working the way it's supposed to. So we can diagnose the problem effectively, but we also can see where the origin is within that sympathetic fight-flight pattern. And thermography is a dramatically useful tool in bringing that about. This Wednesday evening, join us, July 13th, 7:30 at the Roselle Center for Healing, and we're going to be talking about thermographic imaging. You'll really get an understanding of it. You'll be able to see before and after pictures. Your questions will be answered completely. I think it's a night that is extremely useful for your information, for your application, for something that you shouldn't be putting off. This is a test that I have done on a regular basis because of things that have happened to me to make sure that I don't neglect certain procedures. We've talked to you about thermographic imaging being so important for breast exams, and that's what we're going to get into when we come back from a break in a couple of minutes. Tammy, I want to get into that very specifically. But in the meantime, I want you to understand that thermographic imaging is not something that should be a substitution for. It is a complement of. We've talked about the process of the creation of blood supply, vascular neogenesis. Talk about that for a second, Tammy. What really is vascular neogenesis, and why is it important? Why does thermography act in such an important role in picking it up?
Well, as I spoke of before, the medical diagnostics out there all look at mass. They are all looking for mass, meaning X-rays, MRIs, mammograms, ultrasounds. They're all looking for that mass. The difference between the thermogram is that it's not visualizing the mass. It's visualizing the blood flow. The difference between mass for cancerous activity and mass from a fibroid or a cyst is that a fibroid and a cyst do not need a blood supply. So basically what it is, it's that activity, that inflammatory, that vascularity is what the thermogram is picking up. Mass doesn't even form in the breast until the activity is about 6-7 years going. So mass is not generally what we're visualizing here. So as a complementary, it can pick up activity much earlier than mass is visualized.
There's an interesting study that was done actually a couple of years ago and published in the American Journal of Surgery, October 2008, and it was in the effectiveness of non-invasive digital infrared thermography. And very briefly, what they did is they had 92 patients that breast biopsies were done with. But before that, out of the 94 60 of the 94 were malignant, and 34 of them were benign. And the interesting thing is that digital infrared thermography picked up 58 out of the 60 malignancies, 97% sensitivity, far more than anything else. Tammy, we've got to take a break. We will be back after some very important messages, and we're going to continue this process. I mean, that kind of data out there can't be ignored. This is Dr. Tom Roselle.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. Perhaps you've had a problem. Let me see if I can put a solution to it for you and answer whatever question you have in mind, whether it's on topic or not on topic. We're talking about a very important subject, something many of you have had tons of questions on, and you've written me online, and I've tried to answer you, but you know what? I brought the expert in today. My guest in studio, Tammy Leiner. She is a very high-level thermographic technician and partner in thermography centers. This is your opportunity to ask her questions and to get some information. But this Wednesday evening at the Roselle Center for Healing, July the 13th at 7:30 p.m., we are going to be hosting an evening on all the aspects of non-invasive digital infrared thermography. It'll give you the opportunity to see before and afters and ask specific questions about your condition. Give my office a call at 703-698-7117. Tell my staff that you'd like to attend. 703-698-7117. We're going to get right back to our topic, but first we have some people that are holding, and I want to go to the phones. Tom, thank you for holding so long. How can I help you, sir?
Hi, Doctor. Too bad the show doesn't go longer.
Listen, if you have any influence, please do it for me.
None. I don't know if this is something for tomography, because I've had an MRI for it, but for years I've had horrendous headaches after eating, especially the first meal of the day. Sometimes across the forehead, sometimes in the back behind the ears on both sides. And they've taken X-rays and MRIs and don't find anything wrong. Would thermography work on that, or are there some holistic method of helping with those headaches that you know of? Aside from thermography.
The answer is yes, yes, and yes. So first, Tammy, go ahead and you can talk about thermography.
Well, the one thing that I would recommend is that if it happens right after eating, what I'd love you to do is to come in, have a scan done, and then go have lunch and come back, and let's visualize the differences between pre and post to see if we can't visualize it right there in the office.
That's when you have something that's triggered by a certain phenomena, no matter what it is, what you want to do is see, what is it like before it happens, and then what is it like as it happens. And then that often gives you, particularly with something like thermography, because it's non-invasive, there's no X-ray that's going to damage the skin tissue. It can be significant. So it would be a useful piece of information. Now, having said that, when you eat and then you get a headache afterwards, it can be from many different things. It can come from the nerves in the back of your neck being irritated, which have a lot to do with the intestinal tract. It can be from an allergic reaction to the food that you're getting. It can be from an acupuncture problem that because there's unbalance, it's not utilizing those organ systems as proper as they should. So you would do traditional examinations from the things that we do with muscle function testing and neurological testing and so forth. We look at X-rays a little differently as well. So if there's a set of traditional flat plate films, we look at it for the misalignment of the vertebrae, and we look at it for nerve root pressure. We would test many different food sources from muscle function testing at homeopathic levels, and then we would use the thermography to bring it together. But one, yes, it can be found out about. Two, it can be fixed.
Okay, so I guess I ought to come on Wednesday, huh? I
would encourage you to be there, and we can talk to you very specifically about it. I will be there Wednesday night, and I think Dareth Painter, our other thermographer, also partner in thermography centers, will be there, and she'll be doing the presentation, and we can, at least have a one-on-one consult with you.
Okay, and let's try to get you on for 2 or 3 hours on Sunday.
Tom, start a letter-writing campaign and go to the program director of WMAL and say, we have to be here. Thank you, sir.
Thanks again, Doc.
I appreciate it.
Bye-bye.
Rodney, thank you for calling. How can we help you? Rodney. Hello, Rodney.
Yes.
How can we help you, sir? Turn your radio down, my friend.
Sorry, the volume was so low on the the phone that I couldn't determine whether I was on the air.
It's okay. We got a minute. How can we help you?
Yes, I was calling to ask if the thermography is the same as the test that is advertised as a body scan that you hear about on WMAL. Is that the same?
No, it's not.
Technology?
No, it's not the same. That's X-ray. That's radiation.
Oh, it is.
Yes, thermography is a infrared device that records the heat differential from blood supply due to what happens to the nervous system, the sympathetic, the fight-flight system, and it tells. We compare one area of the body to another.
And a lot less expensive.
Oh yeah, I would think. Okay, where are you located?
We're located in Fairfax, right off the National Capital Beltway, Route 50. So we're near Fairfax Hospital.
Are you near Metro?
We're very near Metro. There's Merrifield Metro. We're about a mile away from the Metro.
Okay, well, if you'd give your total address at the end of the show, I'd appreciate it. I would certainly like to...
Not a problem. It's 8550 Arlington Boulevard, and Arlington Boulevard is Route 50. I appreciate it. Rodney, thank you for calling. We're coming up to a break for news and some very important messages. My guest and expert in studio today, Tammy Leiner. We're talking about thermographic imaging and the importance diagnostically. We're going to come back and we're going to talk about breast cancer and other types of pathologies and see if we can open the light for you, so to speak, and make you understand that thermographic imaging needs to be part of your diagnostics. This is Dr. Tom Roselle.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject, whether it's on topic or otherwise. We'll be here to answer your questions. Let's see if we can put a fix to it. We're talking about thermographic imaging, digital infrared thermographic imaging. You've heard us talk about it repetitively over many, many, many months, and we have an expert in studio with us, Tammy Leiner, who is a partner in Thermographic Centers, and she's going to be giving you the skinny on all of this, and we're going to get right back to our topic. However, I want to remind you that coming up September the 17th, Ageless Health 2011, trust me, this is a day that's going to transform your health forever. It's one that you can't afford to miss if you're serious on any level whatsoever of taking charge of your outcome, of your wellness. Not just your health, but your wellness. It's a whole different thing. Wellness really is the ultimate potential that you have as an individual to maximize your body's capacity and physiology. What would it mean to you? What would it mean to you? What would you create? What would you attempt to do if you knew you had the maximum vitality, maximum energy that your body was capable of producing? Do you want to be stronger? Do you want to have a better look about your physiology? Do you want to get rid of all the disease processes? Here's the good news. You can have all of those things, and you can live every day of your life maximally. Totally outrageous. You can constantly improve who you are and what you are. So, are you ready? Are you ready to take control of your health? Are you ready to create greater wellness, not only for you, but the people that you love and that you care about? Ageless Health, September the 17th is an all-day event. It's our keynote event. We've been doing it for 13 years. This is an event that you should never, ever miss because the information changes every year. It's a once-a-year opportunity for you. We've had people say, absolutely unbelievable. Great presentation. They were so glad they came. Excellent. They were amazed. They had no more skepticism about the things that they could do for their life. Don't wait. You need to register today. Our VIP section's already sold out, and our preferred seating is going very quickly, and we're going to be oversold very shortly. So give us a call. You can call the office at 703-698-7117 or go to rosellecare.com, ROSELLECARE.com. You can register right online in a very secured way, no problems, but do it today because I'm promising you this is going to be sold out. We're going to have vendors. You're going to have an opportunity to see exercise demonstrations. We have a vendor that is going to provide, as part of your registration, they're going to provide an organic lunch. You're going to be registered for $1,000 of free alternative health care. Do it today. Don't wait. Don't wait another day. Go online, rosellecare.com. Tammy.
Hey.
Hey, you're going to be there too.
I am.
Yes, you are. You're going to be there. Thermography Centers is one of our vendors, and you'll be there to answer questions not only this Wednesday, but also at our event September 17th. We're talking about digital infrared thermography and why it's important and the things that it can do for you. You know, we said that it's a process that is so important because it visualizes changes within the body sometimes when nothing else will visualize these changes. You know, we have patients that come in, Tammy, and they say, you know, I've been everywhere, I've done everything, I can't find what's going on. They come in from their medical physician and, you know, they say, what else can I do? Well, besides the things that we do, this is one of the pieces. But explain to us why it's so important in those types of situations.
Well, I mean, everybody wants more. I mean, information is key, and everybody wants more information. And if you've done all of the things that you can do medically through your physician, and the only option is to, you know, take a pill for that, or we're going to need to do surgery for that, it's just a different visual. It's just a different way to look at functional patterns in the body. It's very simply and easily put as this is how this process is working or not working.
We know in our practice why we send it out. A patient will come in and they have a thyroid problem, or they have a problem with their spine, or they have rheumatoid, particularly. Rheumatoid is a hot arthritis.
Very hot.
And it shows up very specifically what joint spaces are involved and what joint spaces aren't, because it's, you know, it's unfortunate. So many patients are diagnosed with rheumatoid and they don't have rheumatoid. And there has to be a very set diagnostic pattern that's associated with that. So knowing what we know and when we would use it for breast evaluation and so forth, here's the question. What doesn't it do?
Okay, so I'm going to hit the rheumatoid sort of a situation too. It can also, I just want to say that in any type of arthritic or situation, it can also assess the severity. They may tell you have it, but the severity level is going to be able to be visualized. So you can do, you know, follow-ups will tell you if you're getting better or you're not getting better. So that's the first point I want to definitely talk about. What can't it do? Okay, so of course not much is perfect these days. There is a few areas that thermography screenings are not an ideal situation for. Mostly it's going to be the internal organ types of things. This is where MRIs shine. This is where, you know, that makes the most sense for a lot of the internal sort of situations. On some people we can see, you know, the intestinal processes, we can see stomach, and we can see, but on other people we can't see them, maybe because of their body weight or something like that.
Too much fat, can't see it.
If there's too much, you know, if there's not enough activity, if it's very minimal active, then it's not going to be as easily visualized. So certainly not the cervical area. It's not for prostate screenings or you know, cervical type of situations, but you know, everything from, you know, skin cancer is what it can see, things that very simply that are skin and sympathetic, just like you mentioned before, thyroid, immune function, it visualizes the carotid, and the most we do is the breast screenings.
Can digital infrared thermography show changes in brain circulation?
It's not a very good visual for the brain. Because it's under hair. If you have a nice shiny, you know, bald head and you want to do a thermal screening, that's totally fine.
You mean like me? Well, partially like me.
Well, not all of you.
Be nice. It's a tremendous tool in any type of vascular impairment. We find it when we're dealing with leg pain to rule out whether the leg pain is coming from the back or whether the leg pain is coming from blood supply.
Yep.
We use it, you know, for any kind of autoimmune problem that shows up is a heat signal or an inflammatory reaction in the body. But more importantly, when we deal with any kind of joint space problem, often the pain of whatever it is that we're treating sometimes doesn't resolve as fast as the underlying correction of the condition. And all of a sudden, you start seeing blood supply lessening or a heat signal lessening. That's a better explanation. And we know that within a very short period of time, the heat signal is, as long as it's getting less and less, ultimately will correlate with the pain pattern.
Yep.
So we can see it's getting better, and we can tell the patient, hang in there, see the difference, it's going to get better.
Yep, that's exactly right. It's you can visualize these processes. It's one of my favorite. We talked about it a little bit earlier. Is pre-screening, a scan that's before treatment and then a scan after. It's so incredibly different. There's such a large change in the process. Clients are often overwhelmed, and because they not only they feel better, but they can see that they're better just from the pictures.
Let's talk about one of the more common uses of thermography, breast thermography.
Mm-hmm.
And we've been referring out for breast thermography early on, and we know that the early stages is something called angiogenesis we talked about earlier, and that's just the formation of new blood supply. And what we want people to understand is it doesn't diagnose the tumor. It diagnoses the physiology that is behind the tumor. And then subsequently it shows that, in fact, we have something here, there's a problem, and based on the physician, the medical physician who reads the thermographic scan, his expertise, his evaluation aids in that diagnosis. Now, are you personally, convinced, Tammy, and I'm putting you on the spot, that thermography has the ability to provide women with risk assessment?
Absolutely, for risk assessment. Absolutely. Visually, like we talked about earlier, it's based on the symmetry between the left side and the right side. If one of the breasts looks completely different, meaning there's heat and blood supply and activity, and the other breast doesn't have it, this is a very suspicious scan. This can also give risk factor, and set a baseline. The other part of it is that, mammograms, ultrasounds, MRIs, they all, they're radiated scans. So MRIs are not, and neither are ultrasounds. I mean, just the mammograms with the radiation. But the cost factor is also something that's significant on the other two. So there's no compression, there's no radiation in a thermogram, and when used conjunctively, you're going to get 97%, accuracy.
There was an interesting situation that came about, I think it was about a year and a half ago, that the interesting meaning in my mind is, I'm being very kind, that the medical community finally got it, that they shouldn't be doing mammographic examinations on an annual basis, number one. Secondly, they shouldn't be doing them on women generally under the age of 50.
That's right.
Because the estrogen levels and the hormone levels are still raging.
I love to talk about that. I got some good info on that.
Well, jump into it, because 15% of all breast cancers occur in women under the age of 45. And that's where they wanted to do all these mammographic screenings. But we also know that if you have 4 to 5 mammograms in a row, you increase your risk of getting breast cancer by over 60%.
Yeah, it's absolutely, it's something that it needs to be explained, and this is why. Women who are still menstruating between the ages of 40 and 50, tissue is very dense in menstruating women. So it's much harder to visualize in a mammogram because of the dense tissue. Once that menstruation finishes, the breast tissue becomes less dense, and it's much more easier to visualize mass. When they tried to change the mammogram requirements from 40 to 50, and the world was outraged because of all the women that they're going to miss, for finding breast cancer, this is when thermographic screenings are ideal, because there is no added radiation to this.
No, there is no radiation whatsoever. And you can go, you should start forming a baseline when a woman is 20 years old.
Absolutely, especially if she's at high risk. I mean, if she has a strong family history of breast cancer, if, she is plagued with fibroids and cysts and constantly going in for different types of testing, these are great candidates for, thermographic imaging. One
of the most amazing applications of thermographic imaging when it comes to this type of situation is its effectiveness. I read a study earlier that said that they hit 57 out of 60 cancers that were identifiable. I mean, that's huge. Mammography by itself has a failure rate of about 10 to 15%.
Yeah, the averages are incredible based on biopsies that are performed based on the masses that are found in the breasts, and found that 8 out of 10 biopsies are unnecessary.
This Wednesday evening, the 15th of the month, July, 7:30 at the Roselle Center for Healing. We're in Fairfax, just off the National Capital Beltway, right near Fairfax Hospital on Route 50. Please join us. You're going to have a ton of information on this subject, and you're going to see some interesting visuals. Give our office a call at 703-698-7117. Susan, how can we help you, my friend?
Hi, I'm reading on Wikipedia that the Food and Drug Administration states that thermography is not a substitute for mammography. Would you speak to that?
I'd be happy to. It is the FDA has approved thermography as a diagnostic visual. It's not invasive, and there's no radiation, and it's approved for a subsequent screening tool, but we've never said that it is FDA approved for breast screening. It just is giving you some information. It's not absolutely not a substitute for a mammogram.
The physicians that thermography centers utilize are all medical physicians with years of experience in reading diagnostic images through thermographic imaging. And what you have to understand is what we said is that thermography does not diagnose the mass. It diagnoses the differential.
It visualizes.
It visualizes the differential of the heat signal of the blood supply that goes to the mass. And you can't have a cancerous mass without blood supply. So then it becomes the physician's call. But what we found in our own practice, that every time that we see a signal that early on says we have a potential problem here, then at that point we send the patient out to do ultrasound or to do MRI or to do mammography, and it always correlates 100%. Susan, I hope that answered your question, and if you'd like to have some more data this Wednesday evening, join us the 13th at 7:30 at our office. Just give us a call at 703-698-7117 and tell our staff that you'd like to be there.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We've been at studio, 888-630-WMAL. We're here every Sunday to take your calls on any subject that you'd like to learn a little bit more about. And you can always reach us online at RoselleCare.com. That's RoselleCare.com. And if you'd like to, you could call us, 703-698-7117. But do call us for this Wednesday evening and schedule your reservation to listen to a presentation on thermographic imaging, all those things that you want to know, to see the before and afters, to ask us some one-on-one questions that perhaps you don't want to call in the program with. Call our office, 703-698-7117, this Wednesday evening, July the 13th. Please be there with us. Tammy Leiner, my guest, and we're wrapping this up. We're going to talk to you a little bit more about some of the most effective things. However, Tammy, you have also part of the company that does mobile imaging. We know we have a permanent site in our building, but in addition to that, you get out there. You reach out to different communities. Mm-hmm. Tell us a little bit about that.
I started the program about doing scans at different healthcare centers around Maryland, Pennsylvania, West Virginia, and Virginia itself. I decided that a lot of people can't travel into town, so I've currently have locations in Frederick, Maryland, and Boonesboro, Maryland, and Greencastle, Pennsylvania, but I'm looking for locations in Rockville, Bethesda, Baltimore, and Gaithersburg area as well.
This is something that obviously with a lot of the construction on the road and so forth, we have a permanent center, and you're very welcome to come visit us and say hello to us while you're there, by the way. But in addition to that, if you're a physician and you're listening to this program and you would like to make use of thermographic imaging in your practice, get a hold of Tammy, and you can go online. They can find you there. Yep,
thermographycenters.com, or I have a toll-free number, 888-485-7736.
Give that one more time, Tammy, make sure everybody has it.
888-485-7736.
Or go online at Thermography Centers, And you'll see our site as well there. So you can go online and hook in, and if you'd like to come to our office and have it done there, you're more than welcome to. If you're in the outlying areas and there are areas that are closer to you, please check the website, and you can make an appointment online.
Yep, book online.
And docs, if you'd like to become involved in this, all you need to do is get a hold of Tammy, and she'll come and talk to you, and she'll tell you all about it, and she'll give you the physician's brief, so to speak, on all this information and something that you may like to add to your diagnostic armamentarium. It's extremely effective. It's something that I would encourage all of you to add, whether you're sending out for traditional mammography or you're using other types of diagnostics. This is something that you really should have as part of your practice. Mm-hmm. Tammy, this is a subject that we can actually get into a lot of detail with, but what I want you to do, we have just a few minutes, 20 seconds or so less. Quickly, what are the things that they should do or should call you for to have examined? You got 20 seconds.
Well, I think that the most important part of it is that you should have as much information about your health and your body as that you possibly can. And so as a non-invasive, effective, inexpensive way, this is an easy one.
Tammy is an amazing person. She is very high level and very, very exciting. She has all the information. Come see her, talk to her. This is Dr. Tom Roselle. We're here every Sunday, 12 noon, Dr. Tom Roselle Live. Make sure you tell your friends about it. We'll be right back next week, 12 o'clock. Bye. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, RoselleCare.com. That's RoselleCare.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is